Hello, my name is Paul Maubach. I'm the Chief Exec Officer for Dudley CCG, and I want to talk to you today about the work that we've been doing to develop what's called a multi-specialty community provider here in Dudley. So we've been on this journey for the last 2 years, since April 2015, when we became a national vanguard as part of the NHS New Care Models programme. And most of the work that we've been doing up to date has been developing the way services are organised to deliver the care model that will become the MCP. But over the course of the next year, we're now looking as a CCG to actually procure the MCP, so that from April 2018 we will have an MCP organisation that is running all the services that we're looking to bring together as part of this new care model. So what I'm going to do is talk to you about a bit about what we've done, but also the process we're going through to deliver the MCP organisation. So the MCP, in terms of the way in which we're looking to develop this, will be part of 2 organisations in the Dudley Borough. So on the left we have the planned care and urgent care and treatment services that we'll expect to be delivered by Dudley Group Foundation Trust as part of their hospital. And on the right hand side we have all the services that we're looking to bring together to serve and support population health and well-being, which will be Dudley MCP. And the MCP care model starts with the person as part of a community with their own social networks, supported and registered with their GP practice, which in turn is supported by multidisciplinary teams and other teams working on a wider network across the borough to deliver an integrated model of health and social care. One of the key components of the model is this multidisciplinary team working, and I'll talk more about that in a minute. But what we're looking to do is create teams that work together, taking a shared responsibility with each other to achieve the same set of shared outcomes for the population of their patients across the Dudley Borough. And that starts with teams registered with the practices, but also includes much wider range of services, including community services, community mental health, social work, and services that are currently run and operate out of the hospital. So when we started this work, we started by engaging with the public to find out from their point of view what it is that they need to see from the service. And it really broke down into 3 main categories. So the first one is access. Everyone in the borough at some point needs access to good health and social care. One of our challenges at the moment is what we can't do is guarantee that the same standard of access is available to every single person, regardless of where they live. And that's because currently the services across Dudley, in the community and across primary care, are delivered by multiple different organisations. So one of our objectives in creating the MCP is to standardise and deliver a much more consistent access to our patients, so that we remove any unwarranted variation and can provide the same standard of service regardless of where people live. The second key element of standards that the public are looking for is effective continuity of service. So about 1/3 of our population are living with at least one long-term condition. And what they're looking for us to do is bring the staff together who work on the same conditions, so that they can take a shared responsibility for population health together. So a good example of that is with diabetic care. At the moment we have about 20,000 diabetics who are supported by all of our GP practices, but also some of those diabetic patients also see specialist nurses or diabetologists currently working at Dudley Group. And what we want is for those services to come together so that they can take a shared responsibility for the whole population of diabetic patients across the borough. And in that way we can have teams working across the system, genuinely providing that consistent continuity of service because they are working together as one. The other aspect that the public are looking for is around effective coordination of care. So within our 1/3 of the population who are living with at least one long-term condition, we now have more and more people living with multiple complex comorbidities who need effective coordination of care. And what those people are looking for is that coordination, a seamless service with teams working as one to provide that complex care coordination. And what we've done in Dudley is bring together multidisciplinary teams, which include social workers, district nurses, community nurses, mental health workers, together with the GPs and pharmacists and others, to work together as a team that can take that, again, that shared responsibility, working together as a team without walls, to work together to find the solutions for their patients to deliver that effective coordinated care. And what we're finding from our patients who are receiving that service is they now talk about receiving not just better healthcare, but having a much more effective quality of life, a much better quality of life. And our staff working in this way are also saying that they now feel that they're empowered and have much more to offer their patients because they are working with a team where they can work together to find solutions for their patients. So as we've developed these outcomes, we've also begun to explore how we extend that as the MCP develops, and we're looking to create an MCP which has a long-term contract. So what that enables us to do is really create some stability, both for our public but also for our staff, around how we can then work together to achieve longer-term outcomes. So as you can see from this slide, we not only have the themes of access, continuity and coordination that I talked about before, but we're also starting to look at longer-term population health and how can we improve and support the health and well-being of our population as a whole over a longer-term period. But one of the other things that we've identified, which is particularly important for those people living with more complex needs, is how do we engage as an MCP really with people in their community. One part of the MCP that we've already developed is what we call the Integrated Plus service, which are staff that provide a link between the multidisciplinary team and the voluntary sector. And what they've been able to demonstrate is that, really effectively, is that for people who become socially isolated and where either their carer support or their social networks break down, that becomes a key determining factor in their use of healthcare. And if we can connect people back up together or help them create new social networks, particularly linking through into the voluntary sector, we can reduce their use of health and social care services by as much as 30%. But not only that, they have a better quality of life as a result of that. So we're looking, as part of the development of the MCP, this aspect of social networks and how we genuinely link into a community-based way of working is going to be vitally important for how the MCP works and how our staff engage with people in their own homes, in their own communities, as part of that kind of wider way of working. We're looking at the MCP as well in terms of the type of assets that the MCP has and how we develop those assets. There are multiple different assets that are illustrated on this slide. I'm not going to go through all of them, but I do want to draw out a couple of particular points for you. The first one is our workforce. So the NHS is all about people. It's about the public that we serve, but it's importantly also about our frontline staff and how they support them. And what we want to do is create a way of working which really empowers and supports our frontline staff to work as effectively as possible. And so that's where we have already developed this concept of Team Without Walls, which is really about bringing the right staff together who really have the same genuine interest and need in working together to deliver the same set of shared outcome objectives for their patients. And that could be for a specific long-term condition, it could be for a specific mental health need, or it could be a multidisciplinary team approach to support people with multiple complex needs. But what we want to do is create a way of working that brings the right staff together to work more effectively together to take that shared responsibility with each other for their patients. Another key aspect therefore about this is the culture of the organisation. We want to create an organisation which really first and foremost starts with empowering those frontline teams to work as effectively as possible. So we need to have a way of working that really empowers those teams, sees the value of teams working together. And then the leadership responsibility becomes more about how do we empower those teams and unblock barriers as and when they arise. So it becomes a supportive leadership structure rather than a top-down, protocol-driven leadership structure. So the culture of the organisation for us is extremely important, and it's one that really needs to recognise the importance of supporting the individual to manage their own health and well-being, and then supporting our staff to support that individual in doing that. So culture is really critical, and we're really interested in our staff feedback and also public feedback about what they expect and what they'd be looking for from that culture and way of working. Lastly, one of the other things that I'll talk about, because I've already covered things like the voluntary sector, is the technology. So at the moment we have 46 GP practices in the borough. all of those practices are using the same IT system. That creates a fantastic opportunity to connect up the records and really enable staff to work more effectively together. But we need to open that out so that all the staff and all the services that are part of the MCP can use the same shared record. Our view is if we're able to do that, then we can massively improve the efficiency and effectiveness of our staff because they're working with the same information. So getting the technology right is another key aspect of how we develop this MCP going forward. And our view is if we create a single organisation to oversee this, we're going to have, it's going to be far easier to get that technology and that right and get that infrastructure in place. So one of the things that I'm asked a lot at the moment is, well, what does this MCP, this new organisation, look like? Now I don't have all the answers to that at the moment because the procurement process that we're going to be running during the course of this next year through to April 18 is designed to help us find that answer and determine what the organisation will look like. So what we've got here is a diagram to kind of illustrate one possible scenario, but there may well be other ways in which the MCP could be created, but this gives a good illustration about how it will come together, I think. So what it starts off is with my organisation, the CCG. We will have a single contract for the population of Dudley against those outcome objectives that I talked about earlier, with the MCP as a standalone legal separate organisation. The question then is about how this organisation comes together. One option about how it will be formed is it will be made from a partnership of our GPs and other providers in the system, potentially NHS providers, but also potentially private sector providers. But the idea is to bring the relevant people together to create a single organisation through that partnership. It's absolutely essential that our GPs are part of this, so the MCP can't be created without our GPs, because the whole model starts with the person registered with a practice. And there are two ways in which our GPs can be involved in the MCP. So the way this diagram illustrates it is that each individual practice would still be a separate practice and would have a formal integration agreement with the MCP that defines how the practices will work with the MCP, but also how the MCP will work with the practices. However, practices have the freedom to choose alternatives, which also includes potentially being fully integrated with the MCP, which would mean the GPs and their staff would become employed by the MCP in the same way in which the rest of us would be. The MCP itself isn't going to run every single one of the services that are needed to operate on that community basis. We expect them to employ the majority of staff, but they will have a number of subcontractual arrangements with other organisations. I think particularly a lot of the voluntary sector organisations that will be looking to connect into this. But we also ran what we called a market engagement event in January, a couple of months ago. And we had 65 organisations that came to that meeting to learn more about the MCP and see what they could potentially offer to help create the organisation and support the organisation. So there is a huge potential and a huge interest to bring a wide range of skills and wide range of different organisations to come to bear to help create the organisation that we're looking for. But ultimately, what we're trying to achieve is a single organisation with the lead responsibility for the MCP and the services in it, so that we can bring our staff and our services together to create that sense of shared ownership, shared responsibility, working to the shared outcome objectives that we want them to achieve. Okay, so I hope you found that information helpful. The whole point of what we're trying to do here is to create a new Dudley-based organisation that is all about our staff here in Dudley working for the people of Dudley to support their own health and well-being. And we want to create an organisation that really values both our public and their interest in their own health and well-being, but also our staff and the values that they want to work to and the way in which they should be supporting their patients. This is all about our people, both our staff and our public. So if you've got any questions about this, first of all, there'll be a link underneath this video for the slides which you can click onto, or you can access our website to find more information about the MCP. And if you want to ask us any questions or give us any information or your views about the development of the MCP, you can contact us at the CCG. Our intention is to be in a position whereby that by the time we get to April 18, we are looking to create the new Dudley MCP organisation, and we very much welcome your views and input to help us get there.